Today I will be presenting about environmental and cultural factors regarding the transgender community. According to GLAAD.org, since 2002, there have been about 102 episodes and storylines involving transgender characters in the media. Upon further examination of these characters, they were found to have four common types: victims, villains, killers, and sex workers. These character types often have a negative impact on the population as a whole, as they are grossly inaccurate representations of the transgender community. Family support, or lack thereof, may play a substantial role in the well-being of transgender people, especially transgender youth. It is found that transgender youth experience less depression, anxiety, higher levels of satisfaction and self-esteem, as well as fewer suicide attempts when they felt like their family members were supportive. Peers also play a large role in the health outcomes of transgender youth. When surrounded with other LGBTQ youth or allies, trans youth report having higher levels of satisfaction, less anxiety, and fewer suicide attempts. However, it is found that bullying is still very prevalent among this community. If you look at the graph below, it is found that 24% of transgender youth were threatened with a weapon in school in the last 12 months in comparison to 5% of their cisgender counterparts. It is also found that 27% did not feel safe in school in relation to 6% of their counterparts. One way that vulnerability in this population is cyclical is the cycle of violence and sex work. 62% of murdered trans people are sex workers, making it one of the highest influences on mortality within the community. Due to the cyclical nature of family rejection, bullying, discrimination, lack of employment, and homelessness, sex work is the reality for many people in the transgender community. This perpetuates the cycle of sex work and violence that goes along with it. This reflects the limited livelihood and resources for many transgender people worldwide. One barrier in the transgender community are current laws in place about discrimination in the workplace and public services. As you can see in the pictures on your left, all of the tan-colored states are states that are not explicit prohibitions on discrimination based on orientation or gender identity, thus leaving a gap in the protection for this community. In June of 2020, President Trump also reversed former President Obama's policy that banned healthcare workers from discriminating against transgender patients, creating a potential barrier for transgender people to seek medical attention. Barriers in culture and anti-trans stigma also make this community more vulnerable. For example, there's marginalization culture rooted in lack of awareness, various political stances, and religious beliefs that can put the community at risk for vulnerability. Anti-trans stigmas can also play a role in lack of family acceptance, the perceived need for conversion therapy, and political motivation for things like bathroom bills and employment protections. Overall, it is found that 59% of people interviewed in 2018 find themselves and their countries more tolerant to transgender communities. However, in some places this is not the case. For example, Brazil on average has the highest number of transgender people murdered per capita every year, with the highest rate of fatal violence against the transgender community, making it a very dangerous place for transgender people to live. As you can see, the graph on your right shows images of North and South America and the number of transgender people that have been murdered there between 2008 and 2020. Socioeconomic status also plays a role in health outcomes in this population. Poverty is a large issue in this community, with 29% of LGBTQ people living in poverty, 30% lifetime homelessness rate, and a 15% unemployment rate. These rates can lead to lower preventative health screenings and a lower likelihood of being insured. Race and ethnicity can also play a role in health outcomes. One population in particular is transgender women of color. Not only are they most likely to experience violence and violent homicide, but in a recent study, it was found that combined discrimination of being a woman, being transgender, and a racial minority led to poor coping skills and higher depression symptoms. Another barrier to outcomes in the transgender community includes religion. In a recent survey, it was found that many views on sex are determined at birth. 63% of Christians say that this cannot be changed, and 61% of Protestants believe that society has gone too far in accepting the transgender community. These beliefs within the community can lead to higher instances of depression and anxiety. As I mentioned before, transgender women have a higher likelihood of experiencing sexual violence and sexual homicides. They're 1.8% more likely to experience sexual violence, and 72% of violent homicides towards the LGBTQ community occur towards trans women. It is also found that transgender women are 49% more likely to be living with HIV and far less likely to receive ART for their HIV, leaving a huge gap in treatment for this population. Geographical location can also play a role in finding a provider for transgender people. It is found that transgender-specific providers are spread across the country and often not covered under insurances, making it difficult for someone to spend the time and money to be seen by a specific provider. One solution to this disparity is telemedicine. Telemedicine can decrease the travel and overall healthcare costs by taking the physician to the patient. It is found that there are more successes in pre- and post-operative care in the transgender community after gender-confirming surgeries by using telemedicine for these visits rather than having the patient stay in the location that they had the surgery to have their post-operative care. Implicit or explicit bias on both the provider and patient side can play roles in health outcomes. Some of the implicit biases healthcare providers might have are assumptions on gender, sexuality, and the patient's name. Some explicit biases might be previous experiences with transgender patients. Explicit biases that the patient could experience are previous experience with healthcare providers, both negative and positive. It is found that 30% of transgender patients report delaying care based on previous experience or fear with their healthcare provider. After looking more into the international scope of health outcomes and disparities in the transgender community, I found that health disparities are everywhere. While there are many improvements in trying to decrease these disparities, they vary in magnitude depending on the location. These disparities, however, could be lessened in regions with socialized medicine, explicit employment and public service, and housing anti-discrimination laws. These are some of the references that I used in this PowerPoint. Thank you for listening.